Welcome to today's lecture on the intricate and fascinating field of otorhinolaryngology. In this extensive script, we will delve into the various aspects of sensorineural hearing loss, SNHL, exploring its anatomy, physiology, pathophysiology, diagnostic evaluations, genetic factors, and the impact of environmental factors such as noise exposure and ototoxic medications on hearing. Additionally, we will discuss autoimmune inner ear disease, embryological development, retrocochlear pathology, molecular pathways for regeneration, the role of cochlear implants, and central auditory processing disorders associated with SNHL. By the end of this lecture, you will have a comprehensive understanding of SNHL and its management. So without further ado, let us commence with our first topic. The inner ear is vital for hearing and balance. It consists of the cochlea, organ of hearing, vestibular system, balance, and auditory nerve. Sensorineural hearing loss, SNHL, can result from issues in these structures, affecting hearing and quality of life. In this video, we will delve into the complex cellular and molecular processes involved in the development of sensorineural hearing loss, SNHL. SNHL can be caused by genetic mutations, noise exposure, medications, autoimmune processes, and auditory system disorders. The primary cause of SNHL is damage or dysfunction of the sensory hair cells in the cochlea that convert sound vibrations into electrical signals. This damage can occur due to disruptions in cellular processes like the production of reactive oxygen species, overexcitation of cells leading to excitotoxicity, and abnormal regulation of ion channels. Furthermore, SNHL may involve molecular cascades that trigger inflammation, programmed cell death, apoptosis, and changes in neurotransmitter release and synaptic connections. Understanding these pathways at a cellular and molecular level provides valuable insights into potential treatments for SNHL. Accurate diagnosis is crucial in managing SNHL. Audiological evaluations help identify hearing loss type and severity, using subjective tests like audiometry and questionnaires and objective tests like otoacoustic emissions and auditory responses. Results inform treatment planning and counseling. Genetics is important in SNHL development. Syndromic SNHL has additional clinical features while non-syndromic SNHL refers to isolated hearing loss. Genetic testing has identified numerous genes involved in hair cell development, auditory nerve function, and central auditory processing. This knowledge aids in personalized treatment and potential genetic therapies. Noise-induced hearing loss, NIHL, is caused by exposure to loud noises for extended periods of time. This damages the delicate structures within the inner ear, such as the sensory hair cells, due to oxidative stress and disrupts ion balance. Preventive measures and awareness are important to manage NIL. Ototoxic medications can harm the inner ear and cause hearing loss. They disrupt important cell processes and can damage hair cells and other structures in the cochlea. Common ototoxic medications include certain antibiotics, diuretics, chemotherapeutic agents, and NSAIDs. Monitoring, careful prescribing, and early symptom identification are crucial in preventing drug-induced hearing loss. In conclusion, autoimmune inner ear disease is a complex condition that involves an abnormal immune response leading to inflammation and damage to the inner ear structures. Prompt diagnosis and appropriate management are essential for improved outcomes in patients with sensorineural hearing loss. Understanding the embryological development of the inner ear is crucial in diagnosing and managing sensorineural hearing loss, SNHL. Abnormalities during this process can lead to SNHL later in life. Genetic and environmental factors can disrupt this development, resulting in congenital malformations or abnormalities. By understanding these developmental processes, clinicians can provide appropriate genetic counseling, early intervention, and potential targeted therapies. In the video on retrocochlear pathology and sensorineural hearing loss, SNHL, we explore various disorders affecting the auditory nerve and brainstem. Conditions like acoustic neuromas, neurofibromatosis type 2, brainstem tumors, multiple sclerosis, and vascular abnormalities can impair auditory function. It is crucial to recognize the specific patterns of hearing loss, utilize appropriate imaging, and provide multidisciplinary care for optimal results. Research on sensorineural hearing loss, SNHL, focuses on hair cell regeneration in the inner ear. There is limited natural regenerative capacity in humans, but animal studies have shown promise. Molecular pathways like Notch, WNT, and hedgehog signaling play a role in hair cell development and regeneration. Manipulating these pathways and using stem cell-based approaches may lead to hair cell regeneration in humans. Challenges still need to be overcome, but this research offers potential treatment options for SNHL. Cochlear implants are a valuable tool in managing severe to profound sensorineural hearing loss, SNHL. By directly stimulating the auditory nerve fibers, they can restore hearing and improve speech perception. However, they have limitations in replicating natural hearing and perceiving complex sounds. Proper patient selection, counseling, and multidisciplinary care are important for optimal outcomes. In individuals with SNHL, central auditory processing disorders, CAPD, can cause difficulties beyond the peripheral auditory system. CAPD involves complex neural processes and can result in symptoms like difficulty understanding speech in noisy environments or localizing sounds. Diagnosis requires comprehensive assessment, and treatment may include auditory training and environmental modifications. In conclusion, grasping sensorineural hearing loss, SNHL, is vital for healthcare professionals. We delved into the intricate factors, assessment, and treatment approaches for SNHL. Coordinated effort among different specialists is essential for optimal patient care. Thank you for your attention, and continue exploring this captivating field.